Hey everybody, this is Jackie Smiley with Smiley Mama. And today's topic, we are going to cover low milk supply and what you can do about it. Stay with me. Hey guys, thanks for joining me today. We're going to talk about low milk supply or undersupply. First things first, how do you know if you have a low milk supply? A lot of moms see that their baby is eating very frequently, maybe cries sometimes between feedings, and so they think that they might still be hungry. And their conclusion is, I must not have enough milk to keep my baby content, and they turn to supplementing with formula or donor breast milk. So I think it's important to first understand how we diagnose low milk supply and some of the signs that you may actually be dealing with this, or some of the signs that can be normal and point to that you have an adequate milk supply. So again, I just want to remind you that I am not a lactation consultant. I am a childbirth educator. I have had some training in how to teach basic breastfeeding skills, and I am a mama of 3. I've been breastfeeding for the last 8.5 years straight, and I've dealt with all kinds of different issues. So I just want to share some of my knowledge and hopefully help some of you mamas out there today. Some things that can interfere with making milk have to do with your labor and your birth. So different medications and even just having a lot of IV fluids given to you during your labor can actually affect your milk supply. So we want to keep that in mind, that could be a hurdle that you have to overcome before you've even met your baby. Some other things that can affect your milk supply can be thyroid issues. Thyroid issues can affect your pregnancy, your preterm birth, things like that, but can also play a role in your milk supply. So if you are having trouble, make sure you get a full workup and check out all of your hormones and your thyroid, and make sure that that's not something that's contributing to your struggle to produce milk. IGT, or insufficient glandular tissue, is another thing that can prevent you from making an adequate amount of milk for your baby. Although it is rare, it does happen, IGT, and that's basically where you don't have enough glands in your breast to make an adequate amount of milk. So that's why if you are struggling in the early days, I highly recommend you see a really good lactation consultant so that they can figure out if you have some of these rare things. And so you don't have to struggle for weeks and weeks without knowing what's actually going on. So props out to you mamas who have IGT and have dealt with that, because that is a real struggle for some women. I think the most common reason that moms don't make enough milk actually don't have anything to do with mom at all, but actually have to do with the baby. So if the baby is not latching on properly, if they have a poor latch or a shallow latch, then the baby is not going to be able to remove milk sufficiently to make your body have those signals to continue to make more milk. So making sure that your baby has a good latch is the best way to prevent low milk supply. I definitely recommend, again, seeing an IBCLC to assess your baby's latch, to help you get a deeper or better latch, to make sure that the baby can adequately remove milk. Another reason why a baby may have trouble latching would be that they have tongue or lip ties. And I recently even learned there are cheek ties. So basically, if there is something going on in their mouth that makes them not able to latch as well as they could, then they're going to struggle to remove milk from the breast, which is going to signal your body to make less milk. So you definitely want to be checking in with La Leche League, lactation consultants, There are some phenomenal dentists, people like that. So great chiropractors who can help you diagnose why your baby is not latching properly and get the help you need to maintain your milk supply. How do I know if I have a low milk supply? So most moms are going to be working with pediatricians or midwives in taking care of their newborn babies. So they're going to be checking diaper output. And if your baby isn't having adequate wet diapers and poopy diapers, that's going to be a sign that they're not getting enough milk. Another sign that they might not be getting enough milk is that they aren't gaining weight adequately. So babies poop a lot, they pee a lot, and they gain weight really quickly in those first few weeks. So if those things are not happening, then that points to a low milk supply. You do not have a low milk supply simply because your baby feeds frequently, feeds for a long time, wakes a lot at night, or even if you nurse your baby and then you give your baby a bottle of expressed milk or formula and they suck down the bottle, that's not always an indication that you have a low milk supply. So you definitely want to be looking at those big things like diaper output and weight gain. Those are the two big things that are going to clue you in that you may have low milk supply. Working with your doctor and your lactation consultant are going to help you figure out why you may have that low milk supply. Is it something that was just a hurdle at the birth and you just need to push through and keep baby skin to skin and breastfeeding as frequently as possible and then you will make enough milk? Or is this something where baby needs to have their ties revised or you need to keep practicing and working with the latch? So you definitely need to be reaching out to those skilled practitioners and not just trying to do it on your own, because it really can be difficult to understand the why behind low milk supply or slow weight gain. And you need to know the why in order to fix the problem. If you're pregnant or have just had a baby, I think these things can be really helpful in trying to prevent a low milk supply. How do I prevent a low milk supply? The best way to ensure you have adequate milk is to have a natural, unmedicated birth and not be separated from your baby. So be kept with baby skin to skin as much as possible in those first few weeks, and have complete access to the breast. So anytime baby wants to nurse, immediately the baby can nurse, and that's going to signal your body to produce milk. So remember, feed baby early and often. Some babies are really sleepy in those early days and will sleep for many hours in the night or even during the day. So I think it's important to wake baby to feed every 2 or so hours during the day and at least every 3 hours in the night, at least until your baby is back up to their birth weight, you know you have adequate supply, and you're not worrying about that anymore. If your baby is having not as many wet or poopy diapers each day and isn't growing fast enough, you definitely want to wake that baby so that you're not missing out on any of those feedings that typical newborns get. Also keep in mind in those early days that when the baby's getting colostrum, that they don't need a lot. I think some people, they freak out in those early days because you're literally making like drops of colostrum and they think, oh my gosh, there's no way that this is adequately feeding my baby, or the baby wants to nurse what seems like constantly. And so they think there's no way the baby's getting enough, but God's designed it that way. The baby's only supposed to get around a teaspoon up to maybe even a tablespoon at a time. Their tummies are really small at this point, and they don't need ounces and ounces of milk to sustain them. So don't supplement in those early days that's not the time to assess if your milk supply is adequate or not. So try not to panic in those early days and supplement, because whatever you supplement the baby with, that's that less that your body's going to produce for the baby. So even pacifiers can interfere with this process. The original pacifier is the breast. The baby is supposed to be at the breast frequently. And all of that demand is going to tell your body to produce milk. So don't think, oh, they're just using me as a pacifier. They're supposed to use you as a pacifier. You are the human pacifier. So don't worry about that. If you just let the baby to the breast whenever they will, that's really going to be the best way to ensure that you don't have a low milk supply. Dr. Jack Newman from Canada talks about this, that he sees a lot, supplementing in those early days or early weeks, or using pacifiers early on. You may do okay for a while, but maybe 3, 6, 9 months down the road, now you're suddenly hit with low supply out of nowhere and you have no idea why. And it all goes back to those early weeks. In that first 6 to 8 weeks, you want all of that demand to be on your body to produce milk for your baby. And those first 6 to 8 weeks are going to lay the groundwork for how much milk you're going to have for the rest of your breastfeeding relationship. So it's really important to make sure that all of that demand is on the breast, and you're not quickly just offering a bottle or a pacifier and forgetting that baby needs to be at breast very frequently. Another thing to keep in mind is that the baby's going to go through growth spurts. And when that happens, at first you're not going to have enough milk, but if you keep the baby at the breast as frequently as possible, that will trigger your body to make more milk. So maybe I was nursing, I don't know, let's just throw out a number. Let's say you're nursing 7 times during one day, and then the next day the baby wants to nurse 9 or 10 times. So you might not feel like you have enough milk that day, but when you put the baby to breast, come tomorrow, you're gonna have what the baby asked you for yesterday. So there's gonna be fluctuations where you might not have as much milk on one day as you do the next day. But as long as you're putting baby to breast, your body's gonna make up what the baby needs. I've seen where they say that the baby typically on average only drains about 60 to 70% of what's in the breast. Your breasts are never empty. They'll feel empty at times, but as long as a baby is at the breast, your body is going to constantly produce milk for that baby. So you don't ever have to worry about, well, they completely drained me and I don't have anything left, so I need to just take a break from nursing. You don't need to. Keep baby at the breast as long as they're content there, and you will constantly be producing more milk for that baby. So the big question that a lot of moms have is, how can I increase my milk supply? Like I said before, there's going to be days where you don't have enough milk, but if you keep baby at the breast, you will make enough milk. So I just want to encourage you not to get stuck in that rut of formula feeding, supplementing, and constantly having to give your baby a bottle, and then wondering why you're not making enough milk the next day. So how do you make enough milk? The real tried and true answer to that is let the baby nurse on demand. So your milk supply is based on supply and demand. So the more the baby demands, the more milk you will produce. And trust in that process and try not to get anxious about it. It's really easy to panic and freak out when you're a new mom and think there's no way I'm gonna make enough milk and this is so stressful and blah, I don't know what to do. And it's frazzling, but trust that your body can do this and try to relax as much as you can, and it will work for you. So I wanted to give the example of my first baby. I talked about a little bit last time. She was in the NICU, so we had the separation, and they wouldn't let me nurse her very frequently. So I wasn't getting that demand at the breast. I was pumping, but that's not the same as a baby. If you, for some reason, can't nurse, then yes, please pump. That's the next best thing. But understand that a baby at the breast is going to cue your body way better than a pump will. I brought her home and she was mostly on formula. And we saw a lactation consultant. We worked in her mouth. We did craniosacral therapy. We did all these things and switched pumps. And I was taking some herbal supplements, which those are things that you can try. Some moms do see success with them, eating oatmeal and drinking root beer. And I mean, I did all of the things that they say you can do to try to increase your supply. And honestly, none of it helped at all. But I finally one day had gotten to the point where I was making, I think it was 1.5 ounces. So we did a weighted feed. So I stripped her down to a clean diaper, weighed her, nursed her, and then weighed her again. And she had taken either 1.5 ounces or 2 ounces, which is not a ton, but I did the math, and if she ate every 2 hours for 24 hours, then that 1.5 or 2 ounces would have been considered a full supply. So the day I learned that, I took away formula and bottles completely, and I nursed her exclusively. And in that first about 12 hours, I think she nursed every hour. So that was a lot. And then the next day, my husband was off work, and so I would nurse her and then pass her off to him, and I would pump for 10 minutes or so. And then I'd nurse her, and then I'd pump, and then I'd nurse her, and then I'd pump. And I did that for a day. And then the next day, she was nursing every 1.5 hours. And I think I pumped in the morning and in the afternoon. So just twice. And then by that Monday, so we did it over a weekend. By that Monday, she was nursing every 2 hours round the clock. So through the night as well. But we had completely gotten rid of bottles and formula. So really keeping her skin to skin and nursing, as well as pumping, just kind of forced my body and said, hey, you got to make some more milk. And that ultimately is what got us to exclusively breastfeeding. I think she was about 3 months old at that point. So I say that, that first 6 to 8 week window is really where you lay down, okay, this is how much milk we need to make in the future. But for me, it was later that I was able to establish that supply. So don't give up if you think, oh, well, I missed that window, it's hopeless. I don't believe that. I really believe that your body is going to make milk for your baby. So if you can go on a baby moon and just, hang out in bed or on the couch with baby and keep skin to skin and nurse and nurse and nurse and nurse and nurse, and eat healthy foods and stay hydrated, that's really going to be the best chance you have at making enough milk for your baby. Pumping is great and it's a helpful tool, but it's not going to be as efficient as a baby at the breast is going to be. I hope this has given you some encouragement. Breastfeeding can come with a lot of challenges, but it is the simplest thing. If you consider that you just grew a human in your body and birthed a human out of your body, then making milk is the simple part. Might not be the easy part, but it's definitely the simplest part. So I hope some of these tips have been helpful to you and at least given you some encouragement that you can make milk. Your body will respond to your baby, and seek out those answers if you have questions or if you're having difficulties. There are a lot of helpful practitioners who can get you through this. Have a great day, and we'll see you next time.